Guillain-Barré syndrome, often simply called GBS, is a rare but serious medical condition. It occurs when the body's own immune system, which is designed to protect us from infections, mistakenly attacks our nerves. Think of it as a case of friendly fire. Instead of targeting invading bacteria or viruses, the immune system turns against the peripheral nervous system. These are the nerves that connect your brain and spinal cord to the rest of your body. They control muscle movement, and they also carry sensations like touch, temperature, and pain. When these nerves are damaged, the communication between the brain and the body is disrupted, leading to the symptoms we see in GBS. It is not contagious, and it is not inherited from your parents. So, what exactly happens inside the body during a GBS episode? The problem begins with the myelin sheath. This is a protective, fatty layer that insulates your nerve fibers, much like the plastic coating on an electrical wire. Myelin allows nerve signals to travel quickly and efficiently. In Guillain-Barré syndrome, the immune system's antibodies and white blood cells specifically target and destroy this myelin sheath. This process is called demyelination. Without this protective coating, the nerve signals become slow, weak, or may stop altogether. Imagine a wire with its insulation stripped away. The electrical current can short-circuit. This is precisely what happens to your body's nerve signals during GBS. This disruption of nerve signals is what causes the classic symptoms of the syndrome. Your brain might be sending a clear command to your legs to walk, but because the nerve pathways are damaged, the message simply doesn't get through effectively. This leads to muscle weakness. Similarly, sensory signals from your skin, telling your brain that you are touching something hot or cold, can become distorted or lost. The damage can happen very quickly, over a matter of hours or days. It's a sudden and often frightening experience for patients and their families, as functions that were once effortless suddenly become incredibly difficult or impossible to perform. Understanding GBS as an autoimmune disorder is crucial. It means your body is not being invaded by an external threat during the acute phase of the illness. Rather, it is fighting itself. The initial trigger is often a past infection, but the syndrome itself is the aftermath of that battle. The immune system becomes confused and can't distinguish between the foreign invaders it just fought off and the body's own healthy nerve cells. This is why the condition can appear so suddenly after a person has seemingly recovered from a minor illness. The immune response goes into overdrive, and the peripheral nerves unfortunately become the unintended casualties of this internal conflict. One of the most common questions we hear is, what causes GBS? While the exact cause remains something of a mystery, we know that it often follows a minor infection. About 2/3 of people who develop Guillain-Barré syndrome have experienced symptoms of a respiratory or gastrointestinal infection in the weeks prior. The bacterium Campylobacter jejuni, a frequent cause of food poisoning, is one of the most common identifiable triggers. Other culprits can include viruses like influenza, Epstein-Barr virus, Zika virus, and even COVID-19. The theory is that these germs have molecules on their surface that look very similar to those on our nerve cells, leading to the immune system's confusion and subsequent attack. The symptoms of GBS typically start with a tingling or pins and needles sensation, often in the feet and hands. This is quickly followed by muscle weakness that usually begins in the legs and spreads upwards to the arms and torso. This pattern is known as ascending paralysis. For instance, a person might first notice difficulty walking or climbing stairs. Within a few days, they may find it hard to grip objects, lift their arms, or even smile. The weakness can progress rapidly. In severe cases, it can affect the muscles that control breathing, which is a medical emergency requiring hospitalization and mechanical ventilation to help the patient breathe. Aside from the hallmark weakness, patients can experience a range of other symptoms. There can be severe pain, often described as a deep, aching or cramping sensation in the back and limbs. Some people experience problems with their automatic bodily functions, leading to fluctuations in blood pressure, an abnormal heart rate, or issues with digestion. Facial muscles can also be affected, causing difficulty with speaking, chewing, or swallowing. The progression of these symptoms can vary greatly from person to person, but they typically reach their peak intensity within 2 to 4 weeks after they first appear, making every moment critical. Diagnosing GBS is primarily a clinical process, meaning doctors rely heavily on the patient's story and a physical examination. there is no single test that can definitively confirm GBS right away. A doctor will look for the characteristic pattern of rapidly progressing symmetrical weakness that starts in the lower limbs. To support the diagnosis and rule out other conditions, they will likely order a couple of key tests. One is a lumbar puncture or spinal tap, where a small sample of cerebrospinal fluid is taken from the lower back. In GBS patients, this fluid often shows high levels of protein but a normal white blood cell count. Another useful test is an electromyography, which measures nerve activity in the muscles and can show the slowing of nerve signals characteristic of myelin damage. When a diagnosis of Guillain-Barré syndrome is confirmed, the primary goal of treatment is to stop the immune system's attack on the nerves and support the body's functions while it recovers. It's important to understand that there is no cure for GBS, but there are therapies that can significantly speed up recovery and reduce the severity of the illness. These treatments don't repair the nerve damage directly. Instead, they work by calming down the misguided immune response. The two mainstays of treatment are plasma exchange or plasmapheresis and high-dose immunoglobulin therapy, also called IVIG. The choice between them often depends on hospital resources and the specific patient's condition. Plasma exchange is a procedure that essentially cleans the blood. The patient's blood is drawn from the body and run through a machine that separates the plasma, the liquid part of the blood, from the blood cells. This plasma contains the harmful antibodies that are attacking the nerves. The machine removes the plasma, and the patient's blood cells are then returned to the body, along with a plasma substitute. This process is usually done in several sessions over a period of 1 to 2 weeks. By removing the damaging antibodies from circulation, we can help to halt the assault on the nervous system and give the nerves a chance to begin the healing process. The other primary treatment is high-dose immunoglobulin therapy, or IVIG. This therapy involves an intravenous infusion of immunoglobulins, which are antibodies pooled from thousands of healthy blood donors. It might sound strange to give antibodies to treat a condition caused by antibodies, but it works. We believe these donated immunoglobulins help by neutralizing the harmful antibodies that are attacking the nerves and by suppressing the overall immune response. IVIG is often easier to administer than plasma exchange and is now the preferred treatment in many hospitals. It is typically given daily for 5 days directly into a vein. While these treatments are underway, supportive care is absolutely essential. Because GBS can affect breathing, heart rate, and blood pressure, patients are almost always admitted to a hospital, often in an intensive care unit. Here, a dedicated medical team can closely monitor their vital signs around the clock. If breathing becomes too weak, a ventilator will be used to assist. A feeding tube may be necessary if swallowing is impaired. Additionally, healthcare professionals work to prevent complications like blood clots, which can form from being immobile and bed sores. This comprehensive support is critical for seeing the patient safely through the most acute phase of the illness. The recovery phase of Guillain-Barré syndrome begins once the symptoms have plateaued and the immune attack has subsided. This is when the hard work truly starts, as the body begins the slow process of repairing the damaged nerves. Nerve tissue, especially the myelin sheath, has the remarkable ability to regenerate, but it does so very slowly, sometimes only a millimeter a day. The recovery journey is different for everyone. For some, it may take a few weeks or months, while for others, it could be a year or even longer. Patience and perseverance are key during this time. The focus shifts from emergency medical intervention to long-term rehabilitation. Physical therapy is the cornerstone of recovery from GBS. As strength gradually returns, a physical therapist will work with the patient to help retrain muscles and regain mobility and coordination. The therapy starts small, perhaps with passive exercises to keep the joints flexible, and progresses to more active movements as the patient gets stronger. This could include learning to sit up, stand, and eventually walk again. Occupational therapy is also vital, helping patients relearn the everyday tasks of life, such as dressing, eating, and writing. Speech therapists may be involved if the muscles used for speaking and swallowing were affected during the illness. The emotional and psychological toll of GBS cannot be overstated. Going from being perfectly healthy to suddenly being paralyzed and dependent on others is a traumatic experience. Patients often struggle with fear, anxiety, frustration, and depression. It is incredibly important for patients and their families to have strong emotional support. This can come from family, friends, mental health professionals, and support groups where they can connect with others who have gone through a similar experience. Hearing stories of recovery from fellow survivors can provide an immense source of hope and motivation during the toughest days of rehabilitation. Finally, it is crucial to end on a message of hope. While Guillain-Barré syndrome is a severe condition, the outlook for most people is very positive. The majority of individuals with GBS, around 85%, will eventually make a full or nearly full recovery, regaining the ability to walk and live independently. Some may be left with some lingering weakness, numbness, or fatigue, but they learn to manage these symptoms and lead fulfilling lives. Early diagnosis and prompt treatment are the most important factors in ensuring a better outcome. If you or a loved one experience sudden, unexplained weakness, seek medical help immediately. The journey may be long, but with modern medicine and dedicated rehabilitation, recovery is not just possible, it is the expectation.